Now here in studio with me is Krush. He is the co-founder and CEO of Hyro. Hyro has developed a coronavirus chat box to help healthcare providers navigate the waters of coronavirus as the pandemic spreads. Yisrael, tell me more about this chat box, what Hyro got involved here in these troubling times.
Yes, absolutely. So Hyro is a conversational AI platform for healthcare, which basically means we provide chat and voice artificial intelligence assistant to provide information and answer questions regarding physician services and other health-related questions. Specifically now with the COVID-19 situation, we decided to chip in and offer for free a chatbot solutions that these healthcare providers can deploy immediately on their website in order to triage symptoms and answer frequently asked questions about the coronavirus.
So in a simple term, this means people who have coronavirus or think they may have it can easily access real-time chatting with a medical professional.
Exactly. So it's not even a medical professional. First, it's an artificial intelligence assistant, which basically gets his information from the certified researchers such as the CDC and the WHO. So you can have a risk self-assessment to start with a dialogue, asking about different symptoms, about your location.
So you type in a symptom, and then the artificial intelligence is able to pull from reputable websites, government websites, and what it is you should be looking into.
Exactly, and it's actually like a dialogue, like you are chatting with a real medical professional.
But you do this professionally. I mean, in terms of artificial intelligence and helping businesses and that kind of thing. You said you offered this, you created this for free.
Right.
Why?
So I think that in this crazy situation, we created and had a long relationships with established healthcare providers in the US. When we saw that there is a lot of misinformation and a lot of anxiety and an overload on these healthcare providers' contact centers, we wanted to really relieve some of these pains. So we offered this chat assistant for free for two reasons. One, it's the right thing to do. And second, I think that we can, by that, establish this relationship with other healthcare providers that we haven't been in contact with.
Are you, this new chat box, the Hyro chat box, is it being used primarily or exclusively in the United States? Is it being used in other countries? Is it expanding?
It's being used primarily in the United States. We currently support English only. So we're happy to work with healthcare providers in England or Australia or government institutions, but currently it's mostly in the US.
And especially as the cases, I mean, America now has the most cases in the world, and cases are growing exponentially. How widely used already is the Hyro chat box?
Yes, so we are actually working with one of the leading medical centers in New York City, Weill Cornell Medicine, as well as with a bunch of others all over the states. We're getting thousands of different conversations a day.
Yeah, in New York City alone, more people calling 911 than ever on 9/11. I mean, the cases in New York, more than 30,000 just in that city.
Exactly. So the same comes with the call centers and contact center of these healthcare providers, and we want them to deal with the more serious or specific cases. So we're trying to triage and give some simple answers about the more simplistic use cases.
All right, Krush with Hyro. Sir, thank you so much for the work you're doing and for being with us in studio.